Well, I think in today's climate, the patient is always the number one interest, or should be the number one interest in a doctor's practice. And in any other business, you try to provide some good customer service as well as good care. So we like to think that we're doing high touch, high technology. And by providing remote patient monitoring, we provide high technology to our patients where they can take care of themselves at home and stay home. We also live in a part of the state where we get patients coming to us from remote places, having to drive 2 and 3 hours to get here. So I think anything like this that can make it easier on the patient is something we want to incorporate into our practice. You know, one of the things I tell my patients too is that when you sit in the office with me for about 10 to 15 minutes on a regular office visit, and we go over a plan of care, and that's all well and good. Everybody's in agreement. But when they leave the office and go home, we have no contact with me for about another 3 or 6 months. That plan sometimes go by the wayside. So I think having constant contact with the patient, knowing that we're watching them, watching their blood pressure, watching the heart rate, watching oxygen saturation, makes them a little bit more diligent in wanting to stick with the care plan. Plus, we have contact with the patient, so they know someone's watching them. So I think that type of a procedure just, I think, provides a little more efficacy in the patient staying with the care plan. That's a way to continue our revenue stream, albeit maybe not on the same level as if they were in the office, but we're able to continue the billing with the patient. But that's not my major concern with this program. My major concern is being able to take care of the patient and stay with the patient. So, but don't make the mistake that the billing was important. Well, I think number one, we have been able to keep patients out of the hospital and the emergency room. I think we've had a pretty good success rate with that. And I do think that we've been able to keep the people with their blood pressures in a better range than we have in the past. As you know, blood pressure is not something that stays straight. It's up and down, but we don't see it going way up and then way down. So we've been having a better touch and feel on the blood pressure. Also, with this program, we've been able to help the patients develop some type of exercise program. Now, we're not looking for Olympians, but we'd like to start with a walking program that they can do to increase that, to put that into their regimen on a daily basis. Very well received. I mean, patients like being in contact with the office, with our nurses, and then with me on certain occasions. They feel almost a safety net, so to speak. So it's been well received of the majority of the patients. We're not going back to the way it was before. I mean, this is like the cell phone coming into practice. I mean, I remember saying to myself, I'd never have a cell phone. That's just too encumbering. But now you can't live without it. And that's what's going to happen with this too. They're not going to be able to live without it. The convenience, and again, but not only the convenience, but the actual contact on a not a daily basis, but a regular basis to make sure that they're being compliant. That's going to be the big key right there. I would tell another doctor that this is something you need to get involved with as soon as possible.